Hello, everyone. This week I will be discussing Chapter 5 of your textbook, Engagement and Assessment in Generalist Practice. The learning objectives for this chapter is to employ activities and skills needed for engagement with various size systems, also to assess goals prior to intervention, use behaviors such as defining and describing problems, assess client strengths and limitations, utilizing micro-assessment tools such as the DSM-5, the Diagnostic and Statistical Manual of Mental Health Disorders, the Rathis Assertiveness Schedule, and an alcoholism test. Decide how to work with families following assessment and effectively use home visits as an assessment mechanism. You'll also learn how to assess both task and treatment groups in this chapter and use assessment tools to determine community and neighborhood needs. The book talks about the importance of engagement in your work with clients. When you think about engagement activities, you're talking about greeting the client, demonstrating effective attending skills, discussing agency services, and client expectations. When you think about engagement with client, it begins with the very first contact between the worker and the client. Sometimes there's a formalized process for engagements called intake. These things intake can occur over the phone or in person, but that's just more of a procedural task. There's a lot more involved in engagement. And again, it's demonstrating those effective skills, attending skills. Um, you have to make sure you're greeting the client in order to have proper engagement. And when you're greeting the client, the goal is to make sure that you're building or you're setting the foundation for building good rapport with that particular client. You want to make sure that you provide good eye contact if culturally appropriate. You also want to make sure you're using common courtesies that can extend to the client and beyond. This be Mr. or Mrs. or Doctor, if that is the proper greeting for that particular person. And if for some reason the clients want a less formal greeting, they'll let you know, or you can ask them how do they prefer to be addressed. Um, some social workers engage in small talk or initially build some type of socialization comfort with that particular client. Or sometimes they will engage in small talk to break the ice, and all those things are appropriate. Also, when you're thinking about demonstrating effective attending skills, you want to make sure that you're listening carefully to the client and what the client needs. You want to make sure that when you're listening to enhance your understanding of the client situation. Some people are generally good listeners, and some people need to work on that skill. The good news is that most people can improve their listening skills, and they can learn to improve these skills through practice. When you're thinking about attending skills, eye contact is just one way, but you also want to be mindful of the verbal communication, to nonverbal communication, to show the client that you are listening to them. This may be nodding your head or paraphrasing if necessary, um, smiling, being welcoming in your gestures with clients. When you attend to appropriate engagement with clients, you're also learning how to focus on the client's thoughts and feelings. This is to ascertain how they're feeling and some of the things that they may be thinking. You also want to think about using open-ended questions to provide clients with the opportunity to discuss and expand upon their thoughts and feelings. And sometimes you have to be comfortable when silence occurs in engagement. Sometimes clients need time to process their thoughts and feelings, and so you, being the social worker, may also need to feel comfortable allowing for that silence so that the client has appropriate time to process their thoughts and feelings. Also, when you're in the engagement phase and working on engagement skills with clients, you also want to think about the agency that you're working in. Part of that engagement piece is discussing the agency services as well as the client expectation. You want to be able to help the client realistically assess whether the worker in the agency can help them with their problem. You should take your time to comprehensively, in a detailed way, explain the services offered by the agency, any costs that may be involved, and the length of time for services. This is important because you want to make sure you help the client decide whether the agency as well as yourself can help them with their problems. As a social worker, you should convey your role, or social work student, your role within an agency, and the extent of how much you can help them in that role. You also want to make sure you give the client a choice. They have the choice to accept or receive services, unless it's a circumstances where they're court ordered for services or treatment. But either way, most clients that you will be engaged with, again, unless you're in a court ordered uh, or court mandated service arena, clients do have the critical power of choice, and we want to make sure we honor that. You want to make sure that you provide enough information that a client can make an informed decision about whether they want to seek help with your agency or not. You want to make sure that you don't persuade the client or use other type of tactics or interference in terms of the use of service. Again, this is the client's right to self-determine what they need based on having proper information. If you're ever working in a situation where the client is involuntary, that may happen as well. However, you want to make sure you use the same level of engagement skills as discussed earlier. You want to make sure you greet the client appropriately. You want to make sure that you demonstrate effective attending skills, possibly more so with an involuntary client because there will be a lot of work up front in addressing what we consider resistance because that particular client is not here or not visiting your agency of their own free will. The other thing you want to think about here is what are some of the things that you can do to make that client feel comfortable, even though that they may be involuntary and mandated to have services with you, doesn't mean that you cannot provide them with some area of power and control over how your relationship, your professional relationship with them will look. I find that when you're working with clients that are involuntary, the more you can establish more comfort with them if they are allowed some control over the process, whatever is appropriate given the situation and within the agency. Um, you want to make sure you orient the client to the helping process. You want to make sure when you're orienting the client to the helping process that this is done very early on in the engagement process. Some of this includes making sure the client knows the rules and the conditions under which help is given, whether that is the law governing this or whether it's the agency, an agency policy governing it. But they have to have a good idea of what the policies for help is, what are the rules, what are the procedures, and that they understand what it is that they are signing up for when they agree to receive services. Workers also need to negotiate with clients other type of matters such as the frequency of sessions in which you meet to help that client, perhaps the time and the place of the meetings. They should also discuss the total number of sessions that the client will be receiving. Again, if there's any area where the client has some control over some of this, uh, how the help process looks, particularly for involuntary clients. It really goes a long way in improving engagement and establishing that therapeutic relationship or that helping process um, by developing a strong foundation. Also, completing required paperwork is also a part of the engagement process. Um, Different types of paperwork may need to be signed, such as insurance forms, um, consent for treatment contracts or consent for agency service contracts. Release of information forms may need to be filled out. Emergency contact forms may need to be filled out. Part of acclimating or orienting a client to services, sometimes explaining these forms to clients so that they understand what it is they're filling out and why they need to fill it out, and how that helps set the foundation or set the blueprint for what the helping process is supposed to look like. And this graph here provides a good um, depiction of foundation for generalist practice in terms of engagement. Here you'll see the step one blocks is where you're greeting the client, and then it takes you through the step-by-step sequences of how you work on engagement with clients. Step two being demonstrating effective attending skills. Step three, discussing agency services and client expectations. Step four, deciding whether agency and worker can help. Step five, offer agency and worker services to the client. Step six, orienting the client to the helping process. And step seven, completing the required paperwork. Assessments. So there are different type of assessments that you will be utilizing as a generalist practicing social worker. Um, there's a difference between diagnosis and assessment, and we'll talk about that in a few. Um, Assessment is not just the tools themselves, but it's the approach of assessment. How do you go about conducting those assessments? And then actually completing the assessment or achieving the goals of assessments. When we're thinking about assessment, it involves defining the problem, identifying contributing factors, and recognizing what can be done to reduce or eliminate the problem. Sometimes generalist social workers are evaluating problem situations with the client or within an environment. Okay. A problem can include not only an individual, but also the families in which they are a part of. Problems can also exist in the larger community systems in which clients and families live. When we're thinking about assessments, it occurs at the very moment we meet the client, but it's also ongoing throughout the entire helping relationship. So you're constantly in a state of assessing clients, whether that be new information, new situations, or new problems that may exist. But it happens at first contact and it continues throughout the whole helping process. Also, when you're engaged in the assessment process, you also want to get the viewpoint of the client. You also want to understand how they're processing the help that's going on. You also want to ask them what their reactions are to the engagement process and what their reactions are to the agency itself. You need this type of feedback to help further your understanding. And it also helps with the assessment process itself. So getting ongoing feedback and reaction from clients help within the overall assessment process. When we're thinking about assessing individuals and families, you want to consider such factors such as transactions between and among clients, family members, friends, and or other systems within their immediate environment. You also want to get an idea of what their functioning is within their family or their environment. You want to get a sense of what a client's strengths are, any cultural factors and or customs. And then again, you want to get a good understanding of what that environment is like and how that environment is impacting the individual or family. That environment can be work. That environment can be communities and neighborhoods in which clients live. You also want to be mindful of the life cycle of that particular person when you're conducting an assessment. Um, Clients present at different points of within the life cycle, and that is key to factor in. So an assessment with a child will look a lot different than an assessment with an adolescent and or an adult. Also, when you think about specific problems that can be that you can focus on with an assessment, there are specific assessments for different problems. For instance, there are separate assessments for substance use. There are different assessments for mental health. And so you can target assessments for specific problems presented by the client. There may be some assessments that anyone can do, such as the client for self-report assessments. There are some that a student can conduct, and there are some that require more higher level expertise, such as a professional social worker or a licensed clinical social worker. And so you need to be mindful that as a social worker or generalist practicing social worker, that you're always operating or working within your scope of practice. Right? You also need to be mindful that oftentimes there are ethnic, racial, and cultural factors that may play a role in an assessment. That's from the client perspective and from your perspective as a social worker. So you're bringing your culture in the assessment process, but also you have to realize that how the client may answer the assessment questions or how they may identify the problem may be based on cultural reference, a racial reference, and so forth. Um, you also need to make sure that you are conducting assessments that you are actually skilled and trained to provide. When you're thinking about approaching assessments, you want to look at making sure that you have the accurate assessment of the person, the problem, and or the situation. You want to make sure that assessment is well documented. Documentation is a key area and key role of social workers. You want to make sure that in the assessment that you make sure that you collect the appropriate and accurate information about the problem or the situation. And you want to also make sure that you gather all the information that is needed, analyze it, and make sure it's interpreted properly in your documentation. When you're thinking about assessment, they're occurring at different levels that were already discussed in earlier chapters. You want to assess at the micro level. You want to individual and or family. You want to assess on the meso level, which is could be the family or the community. And you want to assess on the macro dimension, and those are larger systems such as government, larger communities. And then when you're thinking about meso, more neighborhoods. So when you're doing these assessments, you're assessing individuals on all three of those levels. And when you're thinking about assessment, considering assessing through each level that the client engages. So you want to specifically see if that client has individual issues such as depression or anxiety, loss and grief. Uh, you want to also be aware is if there are some meso level assessments that need to be done as well. For instance, the neighborhoods in which they live, or perhaps they're in a family situation where they're isolated. So if you are doing an assessment and someone's dealing with depression and anxiety, and then you also know that on the micro level, but you also know on the meso level that they don't have any family support, and they live in a rural area, perhaps, then you want to then do those macro level assessments to see what type of uh, larger community supports, local government supports, or benefits that can be offered to support or assist that client, as an example. There are also some key things to assessments that you need to be mindful of. The first is that the client must always be involved in the assessment process, and it's absolutely essential that the client is involved in that process. Next, you want to make sure that the assessment always involves making a judgment, right? And sometimes you have to make that judgment call with insufficient or incomplete information. But what the goal is to make the best assessment call with the information that you have at that time. And you may also want to make notes about added information or information that you need to know in order to make a more improved assessment. And then you try to seek that information out so that you can um, have a thorough and complete assessment. Remember, it just doesn't happen when you first see the client. As you're working with the client, you'll be getting more information to make a more complete and accurate assessment as you go. And that's why it just doesn't occur the first time you meet the client. It happens throughout your treatment or helping process time with that client. Another important thing about assessments, you want to make sure you're always doing an assessment that involves strengths. It is very easy working in agencies, different types of agencies, to identify problems in clients because a lot of times these agencies are set up to address the problem. But oftentimes, in order to successfully address the problem, we are oftentimes utilizing the strengths of the clients to deal and address with problems. That's why every assessment that you do should include a list or an assessment or outline of client strengths. Another thing that you may be aware of when you're doing assessments with clients is that sometimes identifying the problem is not always clear, or it's very hard to define the problem based on how it's presented. It may not be a single problem, it may be a multiple problems. Sometimes it may be hard to see which problem came first and which one to address first. Um, you have time, but the key piece here is to remember is usually there's the root problem that you want to dig down. Sometimes clients present with symptoms of the problem rather than the problem itself. And as stated earlier, the fifth thing you need to remember is that the assessment is a continuous activity. Assessments are not easy, they require critical thinking and skills, and you should always use best practice in this area when you're thinking about assessment. When you're thinking about best practice standards, you want to use methods and tools that are valid and carefully and have been carefully evaluated. And you also want to do careful evaluation of the information that is gathered from clients. When you're thinking about achieving the goal of assessment, you want to make sure that you have a clear understanding of the need, problem, or situation that is being experienced by the client. You also want to be mindful of the strengths, assets, skills, and abilities that the clients have. And you want to make sure you utilize these strengths to help improve outcomes for the client. Think broadly when you think about strengths. They can include insights, education, spiritual resources, motivation, intelligence, um, commitment to others, family. Um, you want to make sure you understand what the strength is for that particular client and how those strengths are used for that client to cope and or improve their situation. Also, when you're conducting assessments, you want to be very clear who or what is in the client system. We talked in earlier chapters about client systems. Um, it's a broad term, but when you think of client systems, you're either looking at individuals, families, support groups, social service systems. Anything can be a client system. But understanding what are the systems in which the client interacts is key. And then being more clear on what that client system you're working on actually is. Is it the individual? Is it the family? Is it the employer to which the client is working in? You also want to get an idea of how that client is operating within the systems that are identified within the client systems themselves. Be particularly clear if there are any missing information that you need to gather in an assessment. It may not be available at that time, but you also want to make sure you take notes of the needed information that you'll need. And then you're going to have to synthesize and integrate the information that you have on a client. It is important that we thoroughly do our assessment so that we can develop intervention plans. The plans that we employ will derive directly from the information that is gathered from the assessment. And that is why this process is so important and so crucial. You do not assess correctly, you will put the incorrect intervention in place, and then you will not get the desired outcome that you are looking for. Assessments from a micro-practice perspective. There are many types of problems that can be addressed on the micro level. These types of problems are listed here, and this is just a few. Broad categories in which problems may present. Types of problems includes interpersonal conflict, dissatisfaction in social relations, problems with formal organizations, difficulties in role performance, and problems of social transition. When we're talking about difficulties in role performance, we're talking about that particular client's respective role. A role is a culturally expected behavior pattern that characterizes people having a particular position and status in society. A role can be a mother, a father, a husband, a wife, a brother, a sister, an employee. It could take on many forms, but just be mindful of the different type of roles that your client have and assess that as well. Other problems include problems of life transition, psychological and behavioral problems, inadequate resources, problems in decision making, cultural and religious conflicts, and or prioritizing the problems themselves. You also want to make sure that you're assessing client strengths and limitations. Um, these areas represent areas of strength and potential limitation for clients. Family and friends can be both strengths and limitations depending on their functioning within that particular client system. Education and employment, problem solving and decision making skills, personal qualities that the client may have as well as their characteristics, again, can be strengths and or limitations. Physical and financial resources, attitudes and perspective, religious, religiosity and spirituality, again, may be strengths and or limitations. Resistance can often occur in assessment. Resistance can be a limitation, and resistance also can be a strength. Resistance sometimes may speak to the resilience of the client and the strength of the client. Resistance may be opportunities that you can dig deeper in with your client to help support. Resistance may provide new information about your client that you didn't have before about a particular area or subject that may need to be assessed and worked on. Either way, resistance can be tricky and can be navigated with proper engagement, attending skills, such as listening and reading nonverbal cues. Another dilemma that you can encounter is which problem should you work on? There's plenty of ways to look at this. One approach is to identify the problem which is the most pressing or the most serious in terms of priority and work on that first. Sometimes you may not be able to do that because the client wants you to work on a specific problem in which they feel is most important to them. And some workers will do that, especially if it helps build the rapport and orient the client to helping or reduce resistance with clients. Collecting, organizing, and interpreting client data can be easy or it can be complex depending on the situation. And you also want to be mindful of the questions you decided to ask during the assessment period. All these things can enhance the helping process and engagement um, as it relates to the assessments, or it can be harmful. There are different micro assessment tools that we use in generalist practice or in social work practice specifically, but here are some that you need to be familiar of and be aware of. One is the Diagnostic and Statistical Manual, the DSM. This is our classification of mental disorders. Usually, licensed clinical social workers use DSMs for diagnostic purposes. Diagnostic is different than assessment. Most social workers engage in assessment. Not all social workers are working within their scope of practice um, in terms of the DSM, meaning you have to be licensed clinical social worker in order to make a diagnostic. Again, one of the major difference between assessment and diagnosis is you have to be a licensed clinical social worker. You need higher level of training and licensure in order to do diagnostics, whereas most social workers will do or engage in assessments. Mental health professionals specifically use the DSM-5 to assess individuals by considering specific criteria and descriptors. It is very relevant to clinical work as it provides a variety of a language for a variety of professionals such as nurses, psychiatrists, social workers, and psychologists. It allows these different disciplines to communicate with each other about specific mental, emotional, and behavioral problems. It is also helpful in evaluating and treating clients with mental disorders. It helps allow them to know what is going on with them, and knowing what's going on with them helps you plan, again, the best treatment plan or intervention for that particular client. Another benefit of the DSM-5 is that you can use it to help teach clients themselves about the specific mental disorders and what the symptomology is of it. Having clear categories and descriptors for mental health disorders also helps with research. The DSM-5 also helps, based on its ordering and classification of disorders, helps in gathering of specific statistics that can assist in planning for mental health services. However, there are some limits as well to the DSM-5. One limit is that it only describes particular condition. It does not necessarily provide the intervention strategies for those conditions. Another critique of the DSM-5 is that it focuses a lot on pathology of mental illness, right? It tends to label people. And it doesn't really account too much for that particular individual's involvement in the environment. Another critique of the DSM-5 is that there is some imperfection in how things are categorized. And sometimes a client may present and all the symptoms not be met for a particular disorder, for instance. Also, the DSM-5 is critiqued for its broad outlining of behaviors. So that behaviors are listed so broadly, it can be very difficult. It makes the diagnosis process challenging. The other problem with having broad behaviors listed is that sometimes it can lead to misdiagnosis of patients as well. Another microassessment tool is the RATHIS assertiveness schedule, assessing assertiveness. Um, Assessing assertiveness involves being able to state your thoughts once and feeling straightforwardly and effectively while taking both your needs and needs of others into account. The RATHIS is an instrument composed of about 30 items that measures an individual's assertiveness. Another assessment tool is assessing the alcohol, and other drug abuse. Um, when you're thinking about drug abuse, it allows you to assess somebody's chemical and substance use. Um, when you're thinking about drug abuse in general, you want to think more so about someone using a substance, and usually they're dependent. There's some dependency piece with that substance. Also, when you're thinking about substance use, you're looking at frequency, functioning, person's ability to function, and all those things are captured normally in a drug abuse assessment. Oftentimes with substance use, there's also a form of impairment, um, and degrees of impairment, and that also should be assessed in a drug and alcohol assessment. Another assessment is family assessment. And what are type of things that you're looking at in a family assessment? Um, Families can be complex systems, in that there's a history there and a functioning that you need to assess. Um, Family members usually have obligations to other members of the family. Also, there are subsystems within families, such as siblings. When we talk about families, we utilize language such as group, or we use practice skills that we use for groups. And we also examine them in the meso level of practice. Most social workers will have an opportunity to work with families. And as stated, working with families can be complicated for different reasons. Um, when you're working with family members, different members may have different ideas about the nature, source, and extent of the problems they are experiencing. Each member can have a different view on what the problem is. As a social worker, you want to make sure that all members' opinions and perspectives are valued and that you give attention to each of their individual concerns. You also want to make sure you assess and ascertain each member's set of strengths as well as the family strengths as a whole. In assessments of family, you're identifying problems as well as strengths within the individual members of the family, but you're also assessing the strengths and problems within the whole system itself. What are some of the things you want to assess for in a family assessment? Family communication. Is communication effective? And what are the ways that you think that family communication can be improved? You also want to assess family structure. Structure is a key component in how that family system functions. When we think about family structure, you want to have a good sense of what are the family norms, what are the family roles, and is there a balance or imbalance of power? All these things are incorporated in an assessment of family. You also want to assess life cycle adjustments, how that family adapts to various predictable phases within its life cycle. You also want to assess the impacts of the social environment for families. Are there adequate social supports in place for the family? What are the family resources? How well does that family fit within the surrounding community and or neighborhood? And you also want to assess key areas of family conflict. Um, does the conflict in a given family revolve around marital discord or marital difficulties? Are they parent-child relationship difficulties, personal problems of individual family members, or are there external environmental stressors? You also need to assess the relationships within the family systems. Assessing relationships require that you really have full understanding of the entire family system. When you're understanding and learning about the family system, it requires you to sort out information that you learn, perhaps organize that information in a purposeful way to develop an intervention plan. The book talks about two useful tools on how to gather information on family, and one is the EcoMap and the Genogram. The EcoMap provides a graphic representation of the family's ecological system. In an EcoMap, it will depict family memberships and relationships and can help individuals and families recognize their own strengths as well as their areas of weakness. Here's an example of an EcoMap diagram listed in your book. Um, Because ecomaps and genomaps convey information about a family in a particular point in time, they can also be used to monitor or evaluate changes within a family over time. There's a breadth of systems reflected in the ecomap, which assists the clients to help them visualize their situation from a different point of view, or perhaps suggest areas where change is needed or where resources appear to be absent, and to highlight areas of support within the broader community and or environment. An EcoMap can also be helpful in displaying to families and individuals how their connections and resources actually look. A genogram is another useful tool for family assessment because it also provides a way of depicting a family from one generation to the next. It helps present in a more chronological way a picture of the family, recording such important things such as events, losses within the family system, communication patterns, as well as relationship patterns. A genogram can also depict occupational or work connections. A good rule of thumb in terms of genogram is to make sure that you try to depict, if possible, at least 3 generations of family. Genograms and ecomaps are oftentimes constructed by social workers, and they work with the families together in constructing either an ecomap or a genogram. You can draw these by hand if you're skilled, but most social work students decide to use software in order to construct a genomap. The book provides you some websites on where to go in terms of how to construct a genogram. Another area in terms of assessments would be your home visits. Home visits usually involve calling upon a client in their own homes in order to provide some type of professional services. Um, there is an advantage to doing home visits, particularly for assessment purpose, because you can gain more information during a home visit than what you can obtain in a agency interview situation or an office situation. Home visits are helpful for clients who sometimes have physical disabilities that prevent them from getting into the office. It also serves as a good follow-up function for clients who may be vulnerable, older clients who may live alone, or clients who have chronic mental illness in which traveling outside of the home may be too stressful for them. But either way, home visits are very important because they help you gather collateral information from members of the client's family system, and it also allows you to gather additional information about their living environment as well. This can make it very challenging too doing home visiting. You don't know what the environment may be unless you have an idea of what the zip code is or the area in which the client is working. Um, Sometimes it could be shocking to see the impoverished nature of how clients are living. But sometimes this information is crucial to understanding how the environment may impact other things that may be going on with the client, such as mental health issues or physical issues. Again, if you can get some information ahead of time before going out to prepare for your home visit, this is helpful. It's important to make sure you modify your reactions to client home situations because you really don't know what it is you may walk out and see. It could be poverty, extreme poverty. You may get to the home and it has proper utilities such as water, electricity may not be working properly. Depending on the neighborhood or the client situation, there may be rodents or bug infestations going on in the home. But all these things you need to be prepared for and make sure your reactions to that is as neutral as possible. Basically, because you want to make sure you keep that rapport and that helping relationship with the client and not be offensive. Scheduling home visits. Home visits should be at a time as convenient as possible for family members. However, there are times where social workers may go out and do pop-up visits just to make sure that things that are happening, the client says are happening, are indeed happening. Home visiting can also be challenging for social workers because there's a safety component as well. You must also always consider your safety when visiting various areas and neighborhoods. Um, some areas can be more rough and sketchier than others. Sometimes poverty, violence um, are concerns, and you need to be aware of that. Some social workers or agencies have policies where they go out in pairs to account for this as much as possible. Most social workers usually have a cell phone when they do home visiting work, so they can call if they um, encounter an emergency. You always want to be particularly aware if you're doing home visits in areas that have high crime rates or are considered high risk, and take as many precautions as possible. The book encourages that social workers engage in risk assessments um, prior to doing home visit, making sure you're aware of your surroundings and environments as early as possible. Your textbook also talks about doing as much preliminary work to get to know your client as much of it as possible before going out to do your home visits. One of the things you want to be mindful is if that client has a history of violence or aggressive behaviors. The book also outlines some things that you can do, some helpful tips to stay safe and to prevent a situation from escalating. And I'll just go over them real briefly. Make sure that you remain outwardly calm, regardless of how you may feel. Make sure you always remain respectful toward the individual who may be threatening you, um, courteous and respectful. Continue to face the aggressor and do not turn away from that person. Be sure to use a calm talking voice at all times. If the client is standing, ask him or her to sit down to talk to you. Usually, sitting postures tend to be less threatening. And if you're standing, you may want to think about sitting so that you're not threatening to the client. Avoid defensiveness or taking the person's anger personally. Usually, clients are upset about the situation itself, not you. Be honest in what you say and do not try to promise something that you cannot deliver. Be sure to use appropriate empathy toward the individual's feelings. And if these de-escalation tactics do not work, ask the person to stop or remove yourself from the situation immediately. Now I'll briefly talk about assessments and micro practice. Assessment tools to determine community and neighborhood needs. Generalist social work practice not only provides assessments of individuals and families, but they also provide assessments of communities. These are called community needs assessments, and they entail evaluations of a community's current and potential resources, existing problems, and barriers to solving those problems. There's no specific way, or there's no one best way, of conducting a community needs assessment. However, the book does provide some ideas on how to go about doing it. One is the participatory research model is effective as it uses information from the group most at risk. So the participatory research model can be effective as a means of assessing community using the assistance of the groups specifically that are at risk. An important key part of a needs assessment is making sure you know what type of information you need to make a proper assessment of that community. If you're working in a local agency, you want to know what information will be most relevant in terms of what that agency will be able to do. What are the best ways of obtaining the most useful information, and how difficult will the information be to obtain? Will the information be accurate enough to make effective decisions, for example? You also want to know about the resources available within that community. You want to consider the current state of the community's resource systems. Are there existing resources in the community that could potentially meet the community needs at a lesser cost? Would a needs assessment provide information useful for changing or improving the current state of the resource system within a community? You also want to consider the community attitudes, right? Does the community have the potential to respond positively to the implications of your assessment? Will you find support in the community to carry out the assessment and implement the recommendations? Will relevant community members be willing to provide the information and participate in the assessment process itself? The book goes more in detail and provides an example of a community assessment. Make sure you please take the time out to review more in detail what a community assessment looks like and the example outlined in your textbook.